Good afternoon, Vaidheesh. Thanks for joining us on this chat about fitness and health. I'm aware that you follow the Vedanta philosophy and you're a great proponent of the Vedanta philosophy. Do you believe that a healthy lifestyle can lead to a productive mind and more mindfulness?
Okay, so first and foremost, of course, Vedanta is far more bigger subject to talk with, but I guess it's more to do with the whole concept of healthy mind, healthy body, how both are interlinked. So the important concept I think we all need to understand, which I think it's a great concept, is see blending of oxygen and sugar, basically glucose and oxygen, it's called glucogen. That is what gives energy. So at the end of the day, we should be focused on energy management. So how do you do that? So quite obviously through a proper pranayam or a breathing exercise of making sure you get adequate oxygen in your system, and then make sure the food that you take have the right blend of what glucose, so that we are able to generate the right kind of glucogen for you to sustain energy 24 hours. So that at any point of time, you don't need to feel tired, right? So it's a very important concept. So I try to follow as much as possible, eating the right kind of food, good combination of fruits, vegetables, protein, fat, so that you are able to give the energy, sustain the energy throughout the day. The whole concept, exercise for me, is about how do you sustain energy throughout the day to do what you want to do in life. So that is the principle I would say uh, one should follow in the fitness. Yeah,
So we can say it's ancient wisdom to be leading a healthy lifestyle, which leads to a very calm mind and a productive mind.
absolutely.
Okay. Uh, you are a very successful leader and have been in the devices industry. And today there is the intervention of digital technology through devices, just not just in the common man's life, but also in patients' lives. Can you throw some light on that? Where do you believe is the intersection between digital technology, devices, preventive healthcare, and patient management? Maybe just two or three key points which you believe is an intersection.
I think that interventions, no longer the healthcare is about either drugs or devices or technology. They're all coming into, like as an example, if you want to track your sugar levels today now, something like what GOQii has got, right? You
Yeah,
wear
and
something.
that's amazing. I didn't know you could track your other things too, which we'll come
No,
to. But
what it does that these kind of things help you to, and it can get connected to your glucometer, and then it can trigger information to your doctor. The doctor will get a triggered reporting saying that you are on a spike glycemic excursion, and then if it goes out of range, then the doctor should call you up and say, hey, listen, you seem to be out of range. Are you taking your medicines? Are you eating properly? Whether you are hypo or hyper. So the question here is that though it's a device, at the end of the day, the device is helping in managing your disease. It's just not just a one-time interventions. Even in the area of genomics, I think the predictive diagnostics is going in such a big way, and in a matter of 5 years' time, as I was reading an article, by 2040, you will not be even allowed to die because you will be living so long, and you will be given a choice when to die. So that is going to be the intervention. Your drug, devices, technology, like again going back to people like GOQii will be deciding your future, whether to die or not, right? Because so much of data they'll be collecting about your health, and you can intervene with all this genome mapping, genome editing, gene editing. You can actually prevent people from dying, but for accidents. So the healthcare landscape is going to be really fascinating.
can we safely say that devices or organizations like GOQii also contribute to personalized medicine in some way? Because each one will probably get a personalized kind of prescription based on the data. So, can we safely say that?
Oh, it will be. I don't see why it cannot. because there's so much of data that's going to get collected about a patient. Once you have a data, as they say, data is oil, right? The new oil is data. So given that people who are collecting patient data are going to be the biggest winner in this industry. And that's going to define what specific drugs to be given, what time it's to be given, what form, what dosage. So frankly, I don't even know whether we have the capability to even think what dimensions that's going to produce. It's the whole personalized medicine, personalized technology, wearables, they're all going to make a huge difference.
Where do you see in the pharma space that we adopt digital technology quickly? Will it be more in chronic diseases uh, where you see that this is going to play a greater role, or where do you see a quicker adoption in the pharma space?
See, there are, when you use the term pharma space, pharma is like in the value delivery piece or value creation, value delivery, and value capturing. It's a business model, right? So if you look at it from a value creation piece, pharma industry is really leaps and they're moving at a good space. Technology is sweeping through. Of course, in India is a very different case because we are a branded generic market. It's a very, still the big discovery solutions are not coming to the country. But I'm quite sure that that will change with technology making it easy for access to new drugs. I'm quite sure that India will catch up with what's happening in the Western world.
Especially in chronic diseases, patients struggle to keep track of data, whether it's diabetes or it's hypertension. And especially in the older people, there is a real struggle to keep track of data, especially if doctors need that to track how the patient is doing. So, would you safely say that tracking devices like GOQii really assist patients finally to keep track of their own health and assist in health management and, of course, to better health outcomes?
Yeah, absolutely. In fact, there are some good models that are existing in India. There are some smart people are doing this, what they call the integrated diabetes care. Right from the onset of diabetes, when the patient goes to a doctor, they are put on a tracking mechanism like what you have in GOQii, and then tell them to track how much sugar you burnt, how much calories you burnt, what food that you need to take at what point of time. And then they have a kind of a dongle connected to their mobile phones. So as and when the reading goes up and down, it fluctuates. The glycemic excursion. See, at the end of the day, in diabetes, is not about taking one reading. It's about excursions. The highs and lows are important. So as and when it hits a high, then immediately it sends out an alarm to the doctor. So they give a narrow band target saying that you should be between 180 to say 90. So when you go below 90, the doctor knows he's going to go into hypo. Immediately there will be a call from the call center saying that, hey, listen, have you go and take some sugar to make sure you come back? Have you taken your drugs? Are you not eating food? Right? So the whole idea is to make sure you are well within the range. So the doctors, they give, like, for example, nutritional advice. And nutritional advice are given through various platforms. And then once in a quarter, you go and meet the doctor and make sure that, so this is called as a patient empowerment. So these technology will help the patient to get empowered. Now they become the doctor to themselves because now they have power to manage, correct? So frankly, in my opinion, this is the transformation that has to happen because at the end of the day, chronic disease is about behavioral change. So behavioral change will not happen overnight. And there are companies which are out there which are expert in behavioral change. So I think this integrated diabetes or integrated thyroid management, integrated respiratory management. So that's the reason why I said it's not drugs that matter. It's about integration, particularly chronic. You require a complete system to manage a patient. For example, tracking, how are you breathing, what are you doing, how is your mental state, correct? Everything affects the particular disease. Like for stress-induced diabetes, immediately your reading will go up. There is a severely under stress. So integration of your entire input using technology will greatly, you will be able to manage the disease rather than just taking a one drug, I'm okay. No, that's not a way. This is not acute, this is chronic.
Yeah. What do you have in terms of any fitness secrets of yours, or how do you keep yourself fit? And would you use a fitness device?
Well, see, I don't claim uh, like Akshay Kumar, right? But uh, we're all simple people, normal people, except the fact that you want to be aware that if you are not fit, that it's going to affect your effectiveness in what you do. So I think it's a very important thing is to not to worry about six pack, but having a decent control over your core muscles. So I try to spend time in making sure my core muscles are intact so that your spine remains stable. Because most of the time when you age along, first thing that happens is your spine start giving way because you have not used your core muscle, abdominal muscles. Then it start giving trouble, that nerve irritation start, then you start getting a pain, sciatica and all the stuff. So for me, that is very critical. Second, obviously, is what you eat. So if you want to do a binge eating or a binge drinking, there are always consequences attached to it. So whenever you, I don't think you can prevent from doing that kind of lifestyle, but being aware so that you are able to responsibly deal with that. What goes into your body is completely, you need to be aware. So I entirely remove sugar from my system. Instead, I have jaggery. So I've tried to eliminate rice instead, possibly rajgira and quinoa kind of substitute. And, and and then make sure you eat fruits, vegetables, make sure right kind of proteins are taken. So basically manage your quantities. I think it's not a great secret, but I think it's a matter of paying attention. And sometimes you do get out of control. Go for your detox. I go to Jindal for my detox. So that helps me to get back into control.
Yeah. But what about wearable devices? Would you wear one?
I have tried to follow. Now GOQii is wanting me to do it again. So I will wear. Definitely, it reminds you. More than anything else, I think you tend to have the habit of keep looking at it, how many steps, or how many calories you have burnt. It's a very good discipline. It brings a lot of awareness. And if you have not done anything, then you start evening. If you think you are low, you have not done enough, then go for your walks. It's like a target-oriented approach to living. So it's a very good disciplined approach to. I will definitely try again. Let me see how
you do with this. No, it's been great chatting with you and getting your tips, and I'm sure there'll be more that we'll do with the GOQii. Thank you for your time, Vaidheesh. I think given that the fact that we know Vaidheesh so well and what he does is that we've seen him go through his fitness regime. So we want to end with one statement that we believe he kind of personifies is the body achieves what the mind believes. Thank you. Good morning, Sridhar. So how are we today? Are you feeling healthy and fit?
Absolutely fit and healthy. You can see it here.
Fantastic. So I know that you are a big believer in preventive healthcare, and you also do a lot of regular health checkups for yourself. You encourage that for your employees. In this whole ecosystem of preventive healthcare, what is the role of vaccines, especially adult vaccines?
Very nice. Actually, when you hear the word vaccines, we generally relate it to children. I think it's a time has come when we need to really change that myth. In today's area where work-life balance is challenging, the lifestyles are changing a lot. We travel, the pollution levels, significant chronic care situations. Adults actually require more prevention at this level. There are lots of adult vaccinations available today which require healthy state of mind. One, you can have pneumococcal, you can have flu vaccines, you can have typhoid vaccines. You end up actually saving yourself at a critical time when these vaccines protect and give immunizations. So according to me, adult vaccination is a concept which needs to take off in the country today in a big way.
What is the challenge? Why are people taking on to it as easily?
It's only because of awareness. I think people don't realize that vaccines are for adults also. And they believe that as they age, medications can cure. Medications can cure, but when you really lose your immunity levels, vaccination helps you take care of your own health. So as you age, healthy aging is what we call. It takes care of a lot of prevention. It helps you to be far more immune as you get older in life. So it's purely understanding, awareness, not just at the patient's level, but also the healthcare professional level.
Correct.
Most GPs don't understand need for vaccinations. They believe when you're healthy, you don't need vaccination. But actually, when you're healthy, vaccination helps you to improve immune system.
No, thank you. That's very informative. Now, I know at Pfizer, as a managing director, that you have a big vaccines business and you have a huge innovative portfolio, which is specialty care. But you also have a huge primary care business. Given that digital technology and digital disease management is largely used in the specialty business for patient management, chronic diseases, critical illnesses, do you see a role for digital intervention or technology to aid patients in the primary care or in any other form? Do you see any adoption of digital in the primary care section? And what do you think that could be?
I think India healthcare system is actually transitioning into an era where from a traditional rep, doctor, patient connect, things have to now moving more towards technology and digital led kind of a treatment protocol. Today, till yesterday, patients were depending more on the doctors for the information. Today, if you really look at it, with the advent of internet and lot of information available, patients are very knowledgeable. So primary care is an apt area where we can move from a doctor engagement to a patient education. So we can actually educate patients far more information on healthcare, more in the areas of primary care, which is more common in nature, to really go well prepared to the doctor and also take precautions. For example, respiratory diseases. A lot of areas where simple prevention can take a respiratory diseases, antimicrobial resistance. We take antibiotics very commonly without really understanding what those are. It's important for patients to understand and really have a educated conversation with the doctors on some of these areas. So I believe a lot of areas, even in women's healthcare, areas of hygiene, areas of anemia, these are all areas which are very ripe for a well-educated conversation, education, and this is a way we can actually support the healthcare community by having educated patients. So I fundamentally believe that more education to patients and also to help us to go a little deeper in the geography. Rather than using reps, adding reps, going deeper, we can actually digital to actually reach out to more patients and more doctors, more digital.
That's a very good point. The other question I had was globally. The big pharma industry has adopted digital very quickly. In fact, you see most of our member companies at OPPI have globally started investing in the digital area, whether it's patient care, whether it's artificial intelligence, whether it's blockchain, also tracking of healthy habits. and that's also could be prevention, not necessarily cure, or managing chronic diseases. How fast do you think we'll adopt this in India?
I think, honestly speaking, pharma will take little more time than most industries. I think, at least in India, 95% of our business is generic branded generic businesses. The innovative business is highly ripe for using some of these technologies. Reason I'm saying that is because it's important to understand patients. And most of these technologies are used to really reach out to patients, understand, and reach out to patients more knowledgeable and improve some of the processes. Some of these technologies of artificial intelligence and blockchains are used globally in the areas of research, manufacturing, clinical trials. These are the areas where it's significantly leveraged. Where we believe we can make a difference in India is in the area of really unearthing where the patients are to improve access to medication. For example, oncology. The number of patients really treated in oncology is very less compared to population. Most people don't even know they got cancer. So if you can really use some of the technology to help ease the diagnosis and go understand where the patients are actually situated, we can actually help increase diagnosis rates. So, and secondly, blockchain, I believe, is a huge benefit in India to really prevent counterfeits. Counterfeits in India is a big problem. And I think some of the technology track and trace can be significantly enhanced. Now, it requires us to also invest in retail channels. Our business is fragmented. The manufacturing, distribution, retail is all fragmented. It does require all of us coming together and investing in the technology to do blockchain to track and trace. And we're using barcoding and track and trace, we can actually eliminate counterfeits. Millions of patients take medication without knowing if it's genuine or not genuine. We can do some of these things to really help patients to really take care of themselves.
Very true, very true. Now coming to more personalized medicine, there's also personalized fitness. There are devices and fitness bands like GOQii, like Fitbit, many of them are there in the market. There is a beginning of a collaboration between these personal tracking devices for patients and the medical teams to understand how can we benefit from this collaboration. That is one question. And why is it beneficial to the patient finally, especially in the area of diabetes or in the area of hypertension, which can be chronically managed through tracking your own health data. And the second piece is, do you believe that we hear a lot of startups. There are some more established companies like GOQii and Fitbit, but in the space of startup collaboration with pharma companies, a lot of companies in our member companies are also incubating some of these startups. Where do you think that, where's the sweet spot, or what could be the challenges? Could be both. What do you think? I just wanted to hear your ideas around what could be a sweet spot and what do you currently see also as challenges?
I have been personally involved in some of the startups through some of my company's investments in some of the startups as part of the CSR.
Yes.
I've learned a lot, work closely with them. Firstly, some of the startups traditionally have become startups due to the personal experiences. They faced a problem or they saw a problem and they saw this opportunity to create it. So it's more of been self-created, feeling there's a need gap analysis to get it done. Times are changing now. Now actually, you're actually creating a problem statement. What you visualize the problem state for the future and then start creating solution for the future now today. So say for some of the technologies like health checkups or Fitbit, etc., are actually planning for the future. How the treatment protocol will change in the future, how will patients change in the future, the understanding patients first, understanding consumer first, understand lifestyle first, and then trying to create some of the inventions to suit that requirement. So Pfizer is currently very keen on partnering with startups. We are trying to create an innovation hub for startups. The way we would like to identify a problem statement, identify areas where we believe are areas where startups can help us enhance understanding of patients better, reaching patients better, and work with the startup for ideation to make that work. And that's a kind of partnership, very keen to partnership. Whether in the area of respiratory, oncology, diabetes, anything which helps us to really make our products more accessible and affordable to patients. That's one. That's more from a access point of view. If you look at a country like India, where access to quality healthcare is always a problem, I believe startups can play an integral part in making medication more accessible below the population, people who can't afford medications today. So if you really look at some of the technologies coming in, I was actually looking at one startup, they're actually creating an entire primary care kit wherein they can leverage technology and then hook up a primary healthcare center and a secondary healthcare center and have doctors not physically present in those centers but have nursing staff actually do the test, load up the reports, and then actually can cover wider geography that way rather than having physical infrastructure. Those are things that are going to make our medicines more accessible to people. So I think those are areas where we as pharmaceuticals should partner, encourage the startups, and I believe that's the way to go.
Yeah. No, that's absolutely right. I think there's lots of our member companies in OPPI are looking at that in that direction. I have a last question for you. Is that while you have focused a lot on preventive health checkups, do you believe tracking devices help in actually managing our day-to-day focus and behavior change to remain more healthy?
I completely agree. I don't think I can have anything on this. For example, any organization today, in fact, we have a WhatsApp group in our office, which is called Run Pfizer Run. It started the group of 4 people who are fitness freaks, but that has enlarged so much that there are a lot of people loading every day on how much they ran, which marathon they participated. Not only them, but also the family members. It's actually created a full group out there and really shows how people are focused on fitness and health. And I believe that if we don't really focus on some of these things, that my wife has started wearing it in the last few days, to now she's happily telling me I walked so many steps today. It is really making her feel more motivated to say, if I walk 10,000 today, how do I make 20,000 tomorrow? Absolutely. So it just gets a target. So you set yourself a target, and this kind of devices make you more competitive and also more self-aware about your own health, and you feel nice about it.
No, that's really great to hear. So thank you so much. Thank you very much. I think it's been great talking to Sridhar, and you can hear from him that not just him, even Pfizer remains invested in its employees' health. Thank you.
Thank you very much. Thank you.
Hi Manoj, you're one of those board members who I've seen has undergone a physical transformation, and I'm aware that you're very focused on how you eat and your fitness goals. Can you take me through your journey? What motivated you? Did you use any tracking devices during this whole transformation?
No, thanks, Kanchana. I mean, you are right, and I think you're not the only one who is spotting this. I have reduced around 10 kgs in last 6 months. Being mindful for what you eat, being mindful for how much active you are in your day-to-day is the reason for it. So digital devices have certainly helped it. And being in the part of the healthcare, we always say prevention is better than cure, right?
Now, off late, and actually for many years we've been saying this, but off late there is a clear focus on chronic diseases and patients of chronic diseases, where we focus a lot on behavioral change. So apart from the medicines, of course, that we have, we are as companies, and I'm sure even you and from your organization, are focusing a lot on the wellness of these patients. So be it tracking their diet, be it tracking their blood pressure, their blood sugars, their sleep patterns, their fitness levels. There's a lot in terms of what can be done for patients of chronic diabetes or a cardiovascular illness or hypertension. How much do you think the behavioral change can be aided by digital devices like GOQii, and there are many more, but what do you think, and do you have any thoughts on that?
No, extremely important. The management of chronic diseases, Kanchana, is more becoming a wholesome management of the patient of diabetes, and it is also individualized. So yes, you have drugs, But I think the first prescription with any clinician gives is about lifestyle modification. Yeah. And the digital devices do play a significant role in lifestyle modification. For example, there are apps today which gives you a factor on how much carbs is there in your diet. Yeah, how many minutes you are active in a day. And I think these, if you are able to look at those as a diabetic patient, you can actually reduce your sugar levels or your HbA1c significantly just by doing lifestyle modification. So these digital devices do play a significant role in doing so.
And they do lead to a behavioral change if, of course,
Absolutely.
follow the discipline.
Today, even insurance models are based out of that if you are active, you get a certain discount in your premium, right? So, so this is only because the health is getting better by being active, by being watchful, by being mindful. And if those devices are helping them, then only the insurance companies are looking to give a discount. Yeah. So there is a lot of data to suggest that these devices are.
That is true. That is true. In terms of glucometers or any diabetes management, we moved away from the strips that tell you what it reads. I believe those now you have meters which talk directly to another device, and there are multiple devices talking to each other, which finally gives a wholesome picture to the patient. From a pharma company perspective, do you believe, and I know that some of us are doing work in that area for patients, is that do you believe there should be a thrust in actually communicating the benefits of digital technology and intervention in managing their diseases?
See, at the end, what pharma company is doing, we are working by putting patient at the center of everything. Yeah, and I definitely feel that the pharma companies are giving already some thrust to that how devices can help the patients to better manage their disease and also take the drugs at the right time. So there are a lot of interventions which already pharma companies are doing.
So thank you so much. You've been a motivation for many other members. I hope you continue on your journey of transforming physically and becoming more fit. Thank you for your time.
No, thanks a lot, Kanchana. It's wonderful talking to you.
Excuses don't kill the fat, fitness does. Thank you.